My dear friends, welcome to my channel. This is bincyjoshy. Today we can discuss one disease condition. It's very rare, but it's an emergency. So it is very important to do awareness. Okay, what is that? Neuroleptic Malignant syndrome. What is neuroleptic malignant syndrome? Neuroleptic Malignant syndrome is a life-threatening idiosyncratic reaction to antipsychotic drugs. That means recently when we start some kinds of antipsychotic medication, the client's body has a response to that. It's characterized by high fever, altered mental status, muscle rigidity or stiffness, and autonomic dysfunction. This is called neuroleptic malignant syndrome. Then what are the medications that causes neuroleptic malignant syndrome? We can say typical neuroleptic and atypical neuroleptic. That means typical neuroleptics include haloperidol, chlorpromazine, fluopenazine, loxazine, something like kinds of medications. Then in addition to that, atypical neuroleptics such as clonazepam, olanzapam, quetiapine and risperidone. These kinds of medications causes neuroleptic malignant syndrome. In addition to that, some kinds of anti-emetic medications also causes this disease. Okay. Then what are the signs and symptoms of neuroleptic malignant syndrome? When we think about neuroleptic malignant syndrome or when we diagnose, we have to think one word, fever, F-E-V-E-R, fever. F means high grade fever, E means encephalopathy, V means vital dysregulation, E enzyme elevation, especially myoglobin. Then R for rigidity or hyperreflexia. These are the main clinical symptoms. In addition to that, the abnormal blood pressure, that means sometimes it is going to high and sometimes the blood pressure is going very down. Then altered level of consciousness, diaphoresis, that means excessive sweating, muscle rigidity, generalized tonic-clonic seizure, tachycardia, tachypnea, then positive Babinski's kind, that means meningeal irritation. Then opisthonous posture, that means due to the severe meningeal irritation, the muscles are very rigid and the client has to be in a board-like position. These are the other symptoms of neuroleptic malignant syndrome. Then how we can identify or how we can diagnose neuroleptic malignant syndrome? When we do the laboratory result, the myoglobin level is going to be very high. That means myoglobinuria. Then creatine kinase level also going to be high. Increased creatine kinase level. Leukocytosis occur. Then increased transaminase level. Clear? In addition to that, electrolyte imbalance occur. Low magnesium. Then sodium level should be high in sometimes or low. Potassium level is also going to high. Then white blood cells count is raised. These are the main investigations doing to diagnose neuroleptic malignant syndrome. Then what are the complications associated with the neuroleptic malignant syndrome or NMS? First one, renal failure is occur. Renal failure, acute renal failure is occur. It's not related to chronic. It's an acute renal failure is occur. Then it affect the brain. Then seizure, brain damage occurring. Then almost all organs. It affect all vital organs. Brain, heart, liver, kidney. So when it affect the heart, myocardial infarction is occurring, hepatic failure, it affects the liver, hepatic failure, then disseminated blood circulation, blood coagulation, disseminated intravascular coagulation is occurring. Then in addition to that, sepsis also coming. So these are the main some complications associated with the neuroleptic malignant syndrome. Clear? Then what are the management? When we think about the neuroleptic malignant syndrome, first of all, one medicine has to come to our mind, that is dantrolene. Dantrolene is the drug of choice for the treatment of neuroleptic malignant syndrome. First of all, we have to discontinue the medication. We have to hold the positive medication. Okay, then prescribe dantrolene. Dantrolene, what is the action of dantrolene? It's a skeletal muscle relaxant. It helps to relax the muscle, so we have to give dantrolene. Then bromocriptine. Bromocriptine is a dopamine agonist. These are the main two medications helps given to the client with the neuroleptic malignant syndrome. Clear? Then we can move one simple question. Now we learned about the neuroleptic malignant syndrome. So this question is very simple and you can answer very easily. Okay, then move to this one. A clinic nurse received a family call reporting 104-degree temperature, muscle stiffness and confusion on a client who has been started on flupenazine recently. What is the most appropriate response by the nurse? Somebody is calling from the family. The patient is not at the hospital, at home. So the family members call the nurse. The patient has the signs and symptoms of this one. What are these? 104-degree temperature, muscle stiffness and level of consciousness. That means confusion. The patient has taken flupenazine. What is that? Flupenazine is a typical antipsychotic medication. So the patient has started flupenazine recently. So what is the most appropriate response by the nurse? This is a priority question. Most appropriate. So first option, hold the next dose of medication and arrange for liver function test. Second, administer acetaminophen and muscle relaxant. Third, increase the fluid intake to prevent dehydration. Fourth option, transport client to the nearest emergency room. What should be our answer? First one, hold next dose of medication and arrange for liver function test. Okay, it's a good thing to do that one. Hold the next dose of medication and arrange for liver function test. We did not say about something like that. The liver enzyme should be high. So we can avoid this one. It's not. It's an emergency condition. So only with holding the medications, the patient condition will not be improved. So we have to do something good for the patient to improve the condition. So it's not a right answer. So second one, administer acetaminophen and muscle relaxant. It is a good thing because the patient has high fever. The muscle relaxants also help because the patient has muscle stiffness. But they cannot manage at home. They are at home. Already mentioned in the question, the patient is at home. So with the acetaminophen and muscle relaxant, they cannot manage by self. So the third option, increase the fluid intake to prevent dehydration. We did not say anything. We did not learn anything about the dehydration in the patient with neuroleptic malignant syndrome. So I can avoid this one also. Fourth option, transfer the client to the nearest emergency room. This is our right answer because we learned that neuroleptic malignant syndrome is an emergency. It needs emergency treatment, otherwise the patient condition will worse and if it affects all vital organs, heart, brain, liver, kidney, all organs. It affects all organs. So we need emergency treatment. So just take the client to the emergency department and give the priority care. So this is our answer. Transport the client to the nearest emergency room. Okay, clear, simple, but we have to give the priority to the answer while answering. Okay, then thank you for watching my video. Please share, subscribe and like this video. Bye.